Ballad Health's latest year financial results are in. We've been reporting on CEO Alan Levine's support for a major TennCare change that could hike Ballad's annual revenue by about $100 million. Jeff Keeling reviewed Ballad's results and sat down with Levine. Apparently some good news as well as some bad news. Right, Jeff?
Yeah, that's right, Casey. That TennCare change did make it through and was retroactive to July 2024. That's the beginning of the latest fiscal year. The system probably would have lost more than $60 million in operating revenue without the change. Instead, it made money. But uncertainty over federal funding means things could swing the other way within a few years.
It would have been a difficult year. I mean, $150 million of incremental expense without the revenue to cover it means you have a close to $100 million operating loss.
Ballad Health CEO Alan Levine said that incremental expense was largely from major salary increases over the past few years that have reversed a nursing shortage.
ER wait times were high. People were angry, understandably. We knew it was going to take some time and make some investment to solve the problem. Well, we solved it. Now we're trying to dig our way out.
Ballad got the revenue to cover it. Final approval of a major increase to hospital TennCare reimbursement hit the books in the hospital system's fourth quarter. Ballad's operating income of negative $45 million through 3 quarters finished the year at positive $26 million.
It's a 1% operating margin, so it's not like it's this windfall of new money. This is what should be. We should be reimbursed what the cost of care is, plus, a little bit to recapitalize, and that's what we've got now.
But that TennCare revenue could dip again. The recently passed Big Beautiful Bill would impose limits on the provider taxes that fund it starting in 2028, leaving Levine in difficult conversations with Unicoi County leaders about replacing the flood-destroyed hospital there.
If we decide, look, we don't have enough certainty for a full inpatient hospital, but maybe we have enough to do a freestanding emergency department to bring emergency services back to the community. Those are the types of discussions we're going through right now.
All part of what Levine says are tough choices healthcare providers face in a challenging financial environment. He pointed to Holston Medical Group's recent sale to Optum, which is owned by the same corporation that owns insurance giant United Health.
They didn't wake up one day and say, boy, we want to be owned by an insurance company. They've been proudly independent for their whole existence. So the dynamics nationally are changing.
Since its inception in 2018, Ballad has had a state-regulated inpatient monopoly. Levine says that's allowed it to make decisions that often draw criticism, but he believes the system is better as a result.
The reason that we are financially in a better place than many of our peer systems is because we made some of those decisions. I get the anger. I understand it. I'm not here to tell everybody it's all milk and honey. It's not. The American healthcare system's changing.
Ballad got a win with that TennCare change, but from their longer-term worries to the HMG sale and financial strain at other major physician groups, I think the region's healthcare industry may have some tough sledding ahead in the next few years, and that will absolutely trickle down to patients.